Hello, my name is Isha, and I chose to analyze the 2009 H1N1 pandemic. Step 1. Gather background information. The H1N1 virus is also known as the swine influenza A virus. This is because it has genes linked to viruses causing disease in pigs and birds. The first case of the virus was detected in a child living in California in April of 2009. In the first year alone in the United States, cases reported were 60.8 million, hospitalizations were a staggering 300,000, and sadly, deaths reported were 12,000. Soon enough, on June 11th in 2009, the World Health Organization recognized the H1N1 virus as a pandemic. Step 2. Analyze the current situation. Preventative measures must be taken during this viral disease outbreak. A great way to do this would be to increase surveillance and develop and distribute vaccines. As for a SWOT analysis, one strength of the CDC was that it was able to quickly activate its Emergency Operations Control Sector to help implement prevention strategies to help combat this viral disease. One weakness, however, that would limit this would be that vaccines are not available until late October. One opportunity, however, would be the creation of the National Influenza Immunization Program would promote immunity and give access to millions of vaccines to people worldwide. One threat is that while the virus is contained, it is still here today with the possibility of mutating. Also, all age groups are equally at risk of contracting this virus. The CDC's mission statement is to promote health and quality of life by preventing and controlling disease, injury, and disability. Step 3. Prioritize core issues. One of the main issues is that because the vaccine will not be available until October 2009, this gives the opportunity for the virus to infect more people, increasing the number of cases. One of the main issues is that the virus infects the cells of the respiratory system, which causes infection. This virus also transmits from surface to surface, making it a highly communicable disease that spreads quickly by human transmission. Thus, it is vital to slow the spread of the disease by having school closures and encouraging people to stay hygienic and practice social distancing. Step 4. Analyze alternatives. The health belief model is an effective framework that can educate and motivate people to recognize their susceptibility to this virus and encourage them to change their behavior. One approach they can take is to get vaccinated. This is the easiest way to promote herd immunity. The second approach they can take is to stage an education intervention. The school setting is probably the most effective way to reach both parents and students on a wide scale. This can include sending newsletters to the home and having parent-teacher conferences that educate parents on how to inform their children on staying safe during the disease outbreak. Step 5. Provide recommendations. Perhaps the far most effective recommendation is to encourage people to get vaccinated. Thus, making it a requirement for school or workplace entry can encourage people to stay safe and protect those around them. Free vaccination programs are also an easy way to promote immunity to all groups of people despite their socioeconomic status. The second recommendation would be to promote healthy behaviors. Public places should provide pre-masks and sanitizers. The media should also encourage quarantining and how to practice hygienic measures. Step 6. Establish action plan. It is important that everyone get vaccinated, whether it be students, employees, or any group of people. Also, healthcare providers should treat patients and inform them on the latest safety measures they should be taking. Public health officials should also work with the media to report up-to-date information about the outbreak each day. As for ideal goals, it'd be best if by mid-year of 2010, vaccines being finished distributed worldwide, and by the end of year of 2010, it is ideal that cases, hospitalizations, and deaths drastically decrease. Lastly, by the year 2011, the virus should be eliminated in its entirety and no longer pose a threat. Step 7. My opinion. The H1N1 was a terrifying, highly contagious disease. It showed the importance of how vaccinations can lead to herd immunity. It has also showed the importance to follow mandates such as quarantining and wearing masks to slow the spread of disease. It also showed how human transmission could be a powerful factor in contributing to a widespread disease. Lastly, it is important to be a safe and hygienic individual and to wash hands regularly. Thank you and stay safe.